I'm Dr. Bita, and I work at Center for New Medicine and Cancer Center for Healing in Irvine. I've been working with Dr. Kennedy for about 10 years now. So today I'm going to talk about melanoma. So it's a skin cancer that is not as common as squamous cell carcinoma or basal cell carcinoma, but it is more dangerous in terms of spreading to distant organ, like spreading to the liver or the brain. So we have about 200,000 cases a year, and melanomas are from multiplying melanocytes. Melanocytes are in your skin, and which usually melanocyte produce melanin. It's a protein that protects us against UV radiation. So you dark your skin VR like I am, I have more melanin, that protein that produced by melanocyte, which protects me against UV radiation. And I have less risk of developing a melanoma than someone who's lighter. So melanocytes, when they keep proliferating, multiplying, they can become melanoma. And the way you could know is you could have these mold that changes in shape, and they become indurated, more thickened. Most of the time they're kind of brownish color, but you could have a white melanoma, you could have a tan melanoma. It's not always brown, but most of the time they are. But the mold that you have, they're very benign, and they're usually small, circular, they're regular looking. If they change, like they become irregular shape, it's not a circular, or they become irregular, and they become multicolor, like dark brown and reddish, anything, you definitely want to go to your dermatologist, have it checked. You want to have a biopsy, because if you do have it and you don't address it, melanoma can spread to distant organ, like to liver. And how can that happen? Because melanoma, once that produce, you do produce circulating tumor cell in your blood. And I had a case 6 years later, after removing a melanoma on his legs, it spread to his liver. Or I had a lady who after 30 years, it spread to her brain. I had a patient guy who had the melanoma removed 18 years later, went to his liver and the brain. So we do see cases like that. So you want to make sure when you do have a melanoma and your doctor removes it and say, oh, you're fine, it was in situ, or we got everything, you don't need to be worried. And if you they just say, just come every 6 months and do a skin check, or a year, that's not enough. You want to know, did your melanoma produce circulating tumor cells that are going to cause metastasis? If they're in situ, melanoma in situ, most likely it doesn't. Circulating tumor cell, that blood draw is usually 0. But if it is melanoma, and if you want to draw that blood test, because if you do have circulating tumor cell throughout the year, it can add on and metastasize to a distant organ. Like most common is liver first and then the brain. So how can you prevent from metastasis? It's good to do this kind of testing. Another test I like to do is called fasting PHI, which is a phosphohexoisomerase enzyme, which is a marker of fermentation. When that goes up, that means the body has a cancer environment, and you don't want to have that. So you want to reverse that. You want to make your body aerobic, not anaerobic. So you want to oxygenate your body. Some people say, oh, I jog all the time, I exercise all the time. That may not be enough. Your cell may be acidic. Too much exercise is not good either. You want to know if your body have enough antioxidant that protects you against UV radiation. Ideally, if you have high level of vitamin D, vitamin D3, vitamin D2, you want to check both those levels. You want to be like greater than 50, greater than 70, to protect you against radiation, against UV radiation, against other cancers. Antioxidant in general protects us. So if we have enough antioxidant in our body, we don't even get sunburn much. We don't get damage because antioxidant covers your skin and protects you against UV radiations. So you want to make sure your body's oxygenated. You want to make sure your body's sugar is low, the inflammation, which is HSCRP, high sensitive C-reactive protein. You want to make sure that's low with patients with history of melanomas. You want to make sure you see a functional doctor beside your regular dermatologist because you want to look deeper into that. And I had patients with melanoma that were stage 4 that he's still my patient and he still lived. We reversed his stage 4. But there is immunotherapy drugs out there now, Keytruda, other drugs that is really helpful. When patient becomes stage 4, it helps them. It can, stop the worsening and even can sometimes reverse their cancer. But you don't want to get there. It's all about being preventive. Anyways, I hope this was helpful. Thank you for tuning in.